ji, Mr. Manish Rastogi, and Raghav from the BigPodium for giving me an opportunity to speak on the topic of financial sustainability in healthcare, balancing quality, accreditation, and cost. So thank you very much. Before I start with my presentation, I would like to introduce my organization because I have already been introduced to all of you by Raghav. Uh, well, AHPI, I'm currently working as a director at AHPI, and I am in Delhi office. We have two offices, Delhi and Bangalore. I sit in Delhi office, and Association of Healthcare Providers. AHPI is a registered society under the Society Registration Act, and we represent the vast majority of private healthcare providers in India, and we work through our 20 state chapters, so covering entire India. We have, because health is a state subject, so we have created the various state chapters. So practically we are present pan-India, and we uh, educate our member hospitals. We have about 20,000 hospitals across the country, hospitals of different sizes, small, mid, and large size. And they are located in Tier 1, Tier 2, Tier 3 cities. And we work with an objective to achieve all components of universal health coverage, that is accessibility, affordability, and acceptability. So acceptability, that is the quality care, and of course, availability, to achieve comprehensive health security for all in the country. Now, we have, through our advocacy work, we have in fact created a great impact in the healthcare industry through and created big reforms in the healthcare industry. We have also facilitated several policy changes which has impacted all the sectors of healthcare on the issues of taxation, tariff, costing, reimbursements, quality and accreditation, medical education, health insurance, pharmaceuticals, medtech, environment, legal and regulatory compliances, among others. Now, just this is a very introductory slide about the healthcare ecosystem. So when we talk of healthcare ecosystem is not only, the clinics and the hospitals. So the whole gamut of healthcare, if you see, there are various sectors, which includes clinics, hospitals, diagnostics, medical devices, pharmaceuticals, digital health, health insurance, home care, quality and accreditation in healthcare, research, clinical trials, medical education and training, medical tourism. And so this is, healthcare is something which is ever evolving. And these various sectors, they represent the healthcare ecosystem. Now coming to the topic of today's discussion in the masterclass, financial sustainability in healthcare. Now, let me just tell you what financial sustainability in healthcare means. It is basically, the deployment of financial resources in a manner that supports long-term economic, social, and environmental objectives, while ensuring the continued availability and accessibility of healthcare services. So financial sustainability in healthcare involves optimizing quality of care and meeting the accreditation standards and managing the cost effectively. This approach to financing, it recognizes the interconnection between the financial viability, social well-being, and environment sustainability. Next. Now, need for financial sustainability. Why there is a need? Why there is a need for financial sustainability? See, ensuring continuous operations of the healthcare facility. You commission a hospital, you start running the hospital. and then you need to continue with your operations. And financial sustainability is essential to ensure the day-to-day operations of healthcare facilities, and which includes, of course, the payment of salaries, the maintenance of infrastructure, the procurement of essential medical supplies. So without a stable financial foundation, healthcare facilities may have to struggle to meet these basic operational needs, which of course will, jeopardize the continuity of care, of course. And the next important point when we talk of the need for the financial sustainability in healthcare is investment in infrastructure and technology. So healthcare, as I told you, is an ever-evolving field with constant advancements in medical technology, in treatment modalities. So financial sustainability allows the healthcare facilities to invest in and upgrade their infrastructure, acquire state-of-the-art medical equipment, implement cutting-edge procedures. This is very, very crucial for providing high-quality healthcare services and staying competitive in the rapidly evolving healthcare landscape. Now, next is recruitment and retention of skilled staff. So competent and well-trained staff, they are the backbone of any healthcare facility. Financial sustainability, it enables facilities to attract, to recruit, and to retain the skilled medical professionals by offering competitive salaries, by offering benefits, and professional development opportunities. Now, another important point here is ensuring the quality patient care, which is very, very important. So if you see the financial sustainability, it directly impacts the quality of care, which is provided to the patients. It allows the healthcare facilities to maintain the stringent safety standards, adherence to the regulatory requirements, investment in continuous quality improvement initiatives. So quality patient care not only contributes to the, I would say, the positive health outcome, but also enhances the reputation of the healthcare facility. Now, another factor is capacity building and expansion. Of course, financial sustainability is essential for expanding healthcare facilities and building capacity to meet the growing healthcare needs. So this may, involve when you want to expand, construct a new wing, opening additional, adding additional specialties, increasing bed capacity. So adequate funding is crucial for these expansion efforts. Then community outreach and preventive care programs. The healthcare facilities, they play a vital role in promoting the community health through the preventive care initiatives and educational programs. Financial sustainability allows these facilities to allocate resources for community outreach, disease prevention, and health promotion activities, which of course contributes to the overall well-being of the population. Then resilience in time of crisis. This is very, very important. See, healthcare facilities, they need financial resilience to withstand the unexpected challenges. We have already faced COVID. We have all, gone through very bad time. And this public health crisis, natural disasters, economic downturns. So adequate funding resources provide a buffer that allows facilities to, I would say, adapt quickly, maintain essential services, and continue providing care even during advanced conditions. Now, lastly, facilitating research and innovation. I think, it's important that financial sustainability do support the healthcare facilities in engaging in research and innovation. Next. Key components of financial sustainability in healthcare. Because these are the major I should say the building blocks of the financial sustainability in healthcare. The first one is infrastructure investment for growth. It involves the strategic investment in healthcare infrastructure, which will include your construction, renovation, maintenance of healthcare facilities, to ensure that, they meet the current and future healthcare needs. And, these days we see that, there's investment in state-of-the-art medical equipment and technology. They also fall in this category. Then most important is the operational efficiency. Financial sustainability is closely tied to the operational efficiency, and initiatives may focus on optimizing resource utilization, reducing energy consumption, improving overall operational effectiveness. So this not only contributes to cost saving, but also minimizes the environmental impact of healthcare operations. So operational efficiency is the key element. Then talking of the public-private partnership, we all know that collaborations, PPP, can be a crucial component of sustainable finance for healthcare, and it can bring in private investment, expertise, innovation to enhance the quality and efficiency of healthcare services. So well-structured PPPs, the public-private partnership, ensures that the benefits are shared equitably and that the public interest is safeguarded. Then another key component is the community engagement and social impact. Of course, the sustainable finances in healthcare goes beyond financial returns. It includes considerations of social impact and community engagement. And this investment should align with the healthcare needs of the community. The idea is to promote the inclusivity and contribute to improving overall public health. Then innovation and technology is another very key component. And emerging technologies, we all know, and we all are willing to embrace the innovative technologies. And they, of course, they improve the healthcare delivery and outcome, which is a key aspect of financial sustainability. So while there may be initial cost associated with adopting new technologies, the long-term benefits, if you see, in terms of, I would say, I just mentioned about that efficiency, improved efficiency, and patient care can contribute to financial sustainability. So lastly, I think environment sustainability is again a key component, ESG. So healthcare facilitates, it also considers the environment impact of operations. This may involve adopting eco-friendly practices. I just mentioned before also, energy efficient technologies, waste reduction strategies, to minimize the carbon, the ecological, the footprint of the healthcare facilities. Next slide. So important strategies for attaining financial sustainability in healthcare. I would, there may be many, but I'm actually, I would like to focus on the three pillars, I would say. These three pillars are the important, part of your strategic approach for attaining the financial sustainability in healthcare. So first thing is, the first pillar I would say is the cost containment. You have to contain your cost. So how do you contain cost? I would say by streamlining your operations. You have to implement some lean principles to reduce waste, improve efficiency, optimize resource utilization, and you have to negotiate contracts. Many hospitals, they go for the rate contracts, maybe for 2 years, 3 years on the same rate. You have to negotiate better rates with the suppliers, vendors, service providers to lower the procurement cost. Then there, use of technology, of course. Maybe utilize telemedicine solutions to reduce the overhead cost associated with in-person visits and improve the patient access. So it also improves the accessibility. Manage supply chain, efficient inventory management, bulk purchasing. This I already mentioned. When I talked about negotiating contracts. And then, of course, reducing the administrative cost, simple administrative cost. Wherever possible, to eliminate the, waste and redundancies. So this is the important, these are the all important part of that, cost containment. Then second one is revenue expansion, I would say. Revenue expansion is very, very important. If you understand what it is actually, how you go for revenue expansion. So you expand your service offerings, you introduce new services, you add new specialties that meet patient needs, and you expand your market overall. And you enhance billing and collections, improve billing process, reduce denials, deductions, denials, and accelerate the collections. Then negotiate payer contracts, favorable reimbursement rates with insurance companies and payers, attract more patients, invest in marketing and community outreach to attract new patients, increase patient volume. There are various strategies, of course, to increase patient throughout. I mean, you have to increase the patient throughput without compromising the care of quality. I mean, the quality care. So that is something, which comes under this revenue expansion. And the last pillar, the third pillar, is the technology innovation. Technology, I think I will, just touch upon some important aspects of this technology innovation. Otherwise, you can talk on from days and days, you can talk on technology innovation. So one is EMR, of course, electronic health records. You have to adopt and optimize EHR systems to improve your documentation, to improve your coordination of care, to improve efficiency, to improve outcome, improve quality, improve patient satisfaction. So this electronic health record has a long-term effect. And telehealth and remote monitoring, which I just already mentioned again, when we are talking of technology innovation, you have to expand your telehealth services and remote monitoring capabilities to reach more patients and reduce cost. And these days we have, a concept of data analytics, which you use to identify the trends, manage population health, improve clinical outcomes. And another thing, which is the buzz word, and artificial intelligence and machine learning. So those tools, AI-driven tools, can be implemented for predictive analytics and personalized medicines and operational efficiencies. And lastly, I would say digital patient engagement. This is very important, and you have to use technology to enhance the patient engagement through the portals, through the mobile apps, and personalized communications. So by focusing on all these three pillars and implementing the corresponding strategies, healthcare organizations can work towards achieving the financial sustainability while improving patient care and operational efficiencies. Raghav, next slide. See, I think, I have talked about the financial sustainability, the need for financial sustainability, key components, and the strategies. But now let me talk something about the quality, because the topic is, the financial sustainability in healthcare. How do you balance quality and cost, quality, accreditation, and cost? So quality in healthcare, there are various definitions. So I'm not going to define the quality in healthcare. Basically, it is, see, the most key words here is the health outcome, desired health outcome. So the degree to which health services for individuals and populations increase the likelihood of desired health outcomes. So most important for a patient, as a patient, what do you want is, expected health outcome. And it is based on the evidence-based professional knowledge, and which is very critical for achieving the universal health coverage. Next, Gaurav, Raghav, next slide.
Yeah.
1 second.
Sorry, it's taking a little lag.
Yeah, no problem. So why quality in healthcare is important? Because if you don't provide quality services, the impact of poor quality in healthcare, if you see the vicious cycle of poor quality, and you will have more defects, deficiencies, adverse events. And once you have all these defects, you have to do, redo, you have to rework. And there is, you have to incur the time, money, energy, and everything you have to spend a lot while doing the rework, while reworking. So high defects leading to extensive reworking, and reworking, then you do firefighting, of course, again, which is a big hassle. I mean, to do firefighting, to manage all those problems, then you need there's no time to look for the real solution. So poor quality ultimately leads to an unhappy customer, which we don't want. And we all want that our customers should, uh, go back happy, satisfied. And it is an era of not only customer satisfaction, we are talking of customer delight now. So healthcare also, we can say its patients are customers only, because we also fall under the Consumer Protection Act. So they are the consumers, they are our customers. So we don't want them to go unhappy. It is said that if you lose one customer, you lose 100 customers through word of mouth. If you gain one customer, you gain another 10 customers only. But if you lose one, you lose 100. So we do not want unhappy customer. So this is the cost of poor quality in healthcare, or I would say the impact, which is the negative impact, of course. Next, Gaurav, accreditation. See, this is also important. I'm not just going to touch, what accreditation is. The key word here is to improve the healthcare system. I'm not going to read out the definition of accreditation. We all know what accreditation is. We have, our country, we got NABH accreditation came to our country in 2006. Of course, Dr. Girdhar Gyani, who was the Secretary General, Quality Council of India, and was the first CEO of NABH. So he is the one who revolutionized the quality in healthcare and brought NABH. Previously, I used to be an ISO auditor, 9001 Quality Management System. In 2003, I used to be very happy and used to feel very proud that I am an auditor, ISO auditor, which was a very generic standard, of course, and not specific for healthcare. So NABH is a boon to our country. And then another accreditation bodies are the QAI. We have we have Bureau of Indian Standard. Then we have international accreditation bodies. We have JCI, we have AHPI, we have now ISO 7101 2023 for healthcare. So these, accreditation, they are there to ensure that the primary goal is to ensure that the healthcare organizations not only perform the evidence-based practices, but they also give to access, affordability, quality, and effectiveness of healthcare. So, and the most important aspect is of the accreditation, if you see, internationally, it helps you to build your brand. And as a cost-effective healthcare hub, we all know the medical tourism, how India attracts the international patients. And because of the reasons you all know, that there is no waiting, there is no queue. And we are, if you compare to US, we are 1/10. And, it's a preferred destination actually for medical tourism, for the medical value travel. So accreditation has a role in that also. Next, Raghav.
Yeah.
Impact. So what impact does accreditation, the quality and accreditation create on the financial sustainability? So, there is a link between the quality of care and financial outcomes. So I'm just enumerating some, important uh, points, elements here. Better patient outcomes, of course, implementing quality standards, improving your care will definitely lead to better patient outcome. And that's why all the patients are there in the hospital, for better patient outcomes. And reduced hospital readmissions, few medical errors. For these, overall they reduce the healthcare cost. And then we have enhanced patient satisfaction, which can attract more patients and improve market share. Efficient resource utilization and optimized workflows, which reduced unnecessary expenditures, improved reimbursement rates, and regulatory compliances and standards, because accreditation, it mandates you to have all your regulatory compliances in place. So there is a linkage between quality accreditation and financial sustainability. So the result is that the stronger financial performance and sustainability in competitive healthcare, it ultimately, the healthcare landscape, if you see, it makes you more competitive and more sustainable. So this is the impact which quality and accreditation has on the financial sustainability. Next, Raghav.
Yeah.
Balancing cost, quality, and cost. So this is very important. How do you balance quality and cost? You say that I'm giving quality care, so the cost is more. But if you say I lower the cost, but then you have to reduce your quality. So how do you balance? Both are important. Yeah, you need to follow some strategies to maintain quality while managing the cost. At the same time, you have to be very conscious about the cost also, because you have to be financially viable and sustainable. Process optimization. I think you have to prioritize your process optimization. You have to, I would say, invest in employee training. You have to leverage technology for the efficiency gains. You have to implement quality control measures and emphasize on waste reduction, lean practices, maximize your value without compromising the standards. So these are important. And then customer feedback is very important. Customer feedback, we all know that it definitely adds value, because it gives you an opportunity to improve. And because we don't know how we are performing. Sometimes we think that everything is going good, but the customer feedback, sometimes it is genuine, sometimes it may not be genuine, but you have to analyze and address those feedback. Does not mean that a complaint. A feedback can be a suggestion, or it can be a complaint. It can be a comment. It can be a positive feedback. It can be a negative feedback. So feedback, you have to appreciate the staff who you got the positive feedback. You have to address the negative feedbacks. You have to also see that those comments or suggestions given by our customers, how do we value them, and whether we can really implement those measures which they have suggested. So I think customer feedback is a very, very important. Patient satisfaction survey you need to have in all the different areas. Some hospitals I have seen, they have patient satisfaction survey in OPD, in IPD, in lab, in radiology, in daycare, different areas they have here. It is decentralized. It is not that one feedback for the hospital. And then the most important aspect is that you need to have patient-centric care approaches if you want to balance quality and cost. So actually, there are various patient rights which NABH standards have laid down, which we all know, and we have to respect and protect patient rights. We have to focus on respecting and responding to the individual patient preferences, individual patient needs, and their values. It involves the clear communication. You have to have clear communication with the patient, and shared decision making. You have to involve patient in decision making, and understanding the cultural and social factors which influences the health. You have to prioritize the empathy part. Empathy is very important, because we have lost that touch. The service excellence, our medical excellence may be very good. Our clinical care, the doctors, they have done very well. Patient is fine. But then the service excellence is equally important, because the pain point of the patient is that the billing guy, he just did not talk to him. The front office person did not behave well. did not behave well with him or her. So service excellence is empathy, especially when we are directly in contact with the patient, by the doctors, by the nurses, by the technical staff. So, and holistic care. And most importantly, we have to empower patients in their healthcare decisions. Then only we can, expect to improve the outcome and the satisfaction. So this is how we can balance quality and cost. Uh, so I'm almost towards the end of my presentation. And my next slide, Raghav, please.
Yeah, should be there, sir.
This is actually, I have just mentioned here because this is something, a CFO, of a hospital should be, monitoring, because this is some little technical and financial part of it. You need to have some metrics that how you are, where you are as far as the finances are concerned and how you are performing. So this is important. Days in accounts receivable is one important, measure, important metrics. Account receivable. It's a critical KPI actually to monitor for hospitals. Actually, it measures the number of days it takes to collect payments from patients and insurance companies. So this is very important. So high number indicates the hospital is struggling to collect the payments and vice versa. So this is important matrix. Another important matrix is revenue per available bed. This is actually, I would say the hospital ability to generate, revenue based on the number of available beds. So this KPI is calculated by, there's a formula, the total revenue by the number of available beds. So a high revenue per available indicates that the hospital is effectively utilizing its resources to generate the revenue and vice versa. Net patient revenue, this is also important. It is the amount of net patient revenue is the amount of revenue generated by the hospital's patient services, including your inpatient and outpatient care. This is an indicator, a critical indicator, I would say, uh, and to gauge the financial performance of a hospital. So these are some important metrics. Of course, bed occupancy rate is again important metrics. Bed occupancy rate, it measures the percentage of available beds that are occupied by patients. So this is important because it measures your hospital's efficiency in utilizing the resources. Actually, in various areas you can measure the utilization rate. Especially you have 4 OTs. So you please measure the OT utilization rate also. You may be doing only 60 surgeries in a month, but you have 4 OTs. So your utilization is not even optimal. There is a suboptimal utilization of your OTs. So these are very important. I mean, this is just giving you an example of this bed occupancy rate. And lastly, average length of stay, which is, we call it ALOS, is it measures the average number of days that patients spend in the hospital. Of course, for surgical patients, the ALOS is maybe more. For a patient with a simple medical problem, the ALOS may be less, but patients staying in critical care areas, the ALOS may be more. But an ALOS can indicate that the hospital is experiencing capacity issues or inefficiencies in its care delivery process. If you have high average length of stay, so your bed turnover rate, length of stay should be, less. So which can indicate that hospital is effectively managing the patient flow. So these are some important metrics. I think this is for the CFO or the top management to, have these metrics in hand, end of the month, that where you are financially, how you are performing. So this was also important to discuss here as when we are discussing the financial sustainability. So lastly, next slide.
Yeah.
conclusion, lastly, you know, to sum up, I would say that financial sustainability is not just about the economic well-being of healthcare facilities. We are talking of the health of the hospitals, health of the healthcare facilities, but it intricately linked to their ability to fulfill the mission of providing high quality, accessible, and sustainable care to the community. So it is all linked, right? Then, so without the financial sustainability, hospitals may struggle to meet the diverse and evolving needs. See, healthcare is ever evolving. The needs are so diverse and patients are so demanding. Their expectations are so high. You have to meet all these, you need to have, you need to be financially viable and sustainable. So this is in, talking in terms of the broader healthcare ecosystem. So I think with this, I will end my talk here. And thank you very much once again, Raghav, for the opportunity. And this is something which is a very important topic. I think we all need to have a basic understanding of what the financial sustainability in healthcare. So I have not talked about financial sustainability. I'm not competent to talk on financial sustainability in any other sector, but healthcare is so important. And healthcare, the way healthcare is growing, and healthcare is on the political agenda now, and everybody is looking at healthcare, and people are investing in healthcare,
Absolutely.
technology. So I think and it's such a diverse sector, healthcare. As initially, my first slide when I talked about the healthcare ecosystem. So financial sustainability, it is applicable to all the sectors, actually, if you see, when we are talking of healthcare ecosystem. So if there are
Absolutely.
any questions, I would be happy to
Yes,
take the
sir.
questions. And
There are a lot of comments in the chat. I'll go through
oh my
them
God,
one
okay.
and a lot of questions.
Sorry.
Thanks, first
Okay.
of all, again, to ground us on the foundations here and the very critical topic. I think the first question is from Rekha ma'am, talking about what's the impact of healthcare at home on financial sustainability. And that also triggered my mind when you said uh, average revenue per bed, like is the hospital gaining more in terms of financial sustainability by catering more patients with the same bed, or less patients with more revenue within the same bed, and what's the home care value comes in. So Rekha ma'am, please feel free to unmute and add.
Yeah, thank you, Rekha, for asking this very important, a very valid question. Home care is also an important, as the vertical of healthcare ecosystem, if you see. And people are, not talking of only simple care at home, but even having ICU beds at home. These days, we know that technology is so much evolved that we remote monitoring. You are even having ICUs at home. So healthcare, if you talk of the financial sustainability, healthcare at home, it is actually, I would say, uh, you know, it is business. I know many people, who have started this home care business, but they could not sustain. All right, because healthcare at home concept, it is not very much uh, you know uh, taken in our country, but slowly it's becoming very important, especially in other countries. If you see, for the old age, for the geriatrics, healthcare at home, for chronic care patients, it is something which is so important. And if you invest in a home care business these days, what you are going to achieve is initially, because you need to have all the infrastructure, you need to have all the policies in place, you need to have good collaborations with various agencies, you need to have your manpower, the staff, the allied staff, the doctor, the nursing staff, the allied staff, the physiotherapist, you need to have a GD. So all those staff, having them on board, and giving them regular salaries, and uh, investing on technology for the home care. And this is something initially, there is always a break even point, we say. In healthcare, we used to say those days that break even 5 years. Then we used to say 3 years. I don't know, when these new ventures, when do they break even nowadays? But home care is a very, what you say, it takes time to settle down. And there are some good home care, Potia, if you see, it's a good brand in home care. They are, nationally, they are present across the country, and they have actually built up a brand. So to reach to that level, to build up a brand in this area, it takes time. So initially, you may not, find it financially viable. You may see that, you know, there's a lot of investment until unless you have deep pockets, because you may be, having a lot of funding you may require to start this business. Because technology, if you want to invest in technology, you may require funding, or you may be a bootstrapper, what you call, you without any uh, funding, start your own. So healthcare at home, the financial sustainability, of course, is there, will be there, but it will take time. And once you build up the brand and the type of it all also depends upon the quality of services. Most important part in healthcare at home is availability of the staff, and how responsive you are, how quick you are. It is sometimes you have started the venture, but you are not able to manage healthcare at home. You're not able to provide that. Your physiotherapist, you need to have a pool of people. Actually, you cannot rely on one person when you have to provide healthcare at home. So I think it's a very good question, and it is definitely, you need deep pockets, or initially you may have to struggle, and maybe the break-even time is more. You may have to wait for some time, maybe say about 2 years, 3 years, to to become financially sustainable. So that's all I would say about the healthcare at home.
Absolutely, sir. I think the next comment is from Flory, talking about privacy, safeguarding patient privacy. Flory, maybe you can mute and share your question or thoughts there.
Oh,
Yeah,
I
Flory.
was just simply, hi there. It's great to
Flory is
see
my
you.
colleague. She's in USA, actually. She's sitting in USA. She's my colleague. We did this digital health course from IIM Raipur together. Flory, how are
Yeah,
you?
I'm well. Thank you. This
Yes,
was
Flory, please.
a wonderful presentation and definitely worth being up at the crack of dawn. I was just going to say you haven't really mentioned two things, because there's another comment. One is the fact, if you want to talk about financial sustainability, talked about the importance of keeping your technology up to date, but that really specifically applies to safeguarding the privacy and the data that you have about all of the patients. Because if you don't keep up good security, technology security, data security, you can run the risk of being hacked and having your entire healthcare system held hostage for ransom, and that can really wreck your financial sustainability. So
Of course, yeah.
that was one comment, and then the other comment had to do with compliance specifically, because you mentioned educating your workforce, which of course is critical, but that also goes to compliance. And clearly the issues in India may be a little bit different from in the US, but the penalties, the financial penalties for non-compliance are staggering, just staggering. And so it falls, it falls to the administrators or the people who are responsible for the sustainability to make sure that everyone who is on their staff, every single person in every department, knows what their obligations are in terms of compliance.
Mm-hmm. Yeah, thank you, Flory, for asking these two very pertinent questions. I think your first question was on patient, how to protect the patient data privacy, maintaining privacy and confidentiality in healthcare setting. Actually, I did not touch upon this because my topic is something different. But of course, your patient data privacy is very important. Data encryption. We have to ensure that all that patient data both in transit and at rest is encrypted. And we need to use the strong, what you say, encryption algorithms, I would say. And of course, this will prevent the unauthorized access, even if your data is intercepted or, physically accessed. So this is data encryption is one important part if you want to protect the patient's data. Access control, of course, I would say, we have to implement a strict access control to the data to ensure that, only authorized personnel can access the patient's data, giving rights to the access. Then, what do I say? I mean, of course, regular audits and monitoring, to detect any unauthorized access or any anomalies which is happening with the patient data. You have to implement some monitoring tools to track the access and usage patterns of patient data. And you need to train your employees, data backup, recovery, physical security. I think these are all very, very important part of data security. And these days, I think this is wherever we are talking of data, we need to, it comes to your mind that whether my data, patient data is secured, So I think by implementing some of these practices, and maintaining, you have to be very proactive. You need to have a proactive approach to data security, so that you reduce the risk of unauthorized access and any breaches, any data loss. Ultimately, you need to safeguard the patient confidentiality and the trust. And I think second question, you were talking of educating the workforce and compliance to that. That's what I think you were asking, what I understand.
Yes.
I think
Yes.
yes, Flora, it's very, very essential to ensure that the workforce they understand and adheres to all these practices. You need to have your develop your training calendar. I mean training programs, and you need to have regular updates. And but then those who are not attending the training, I remember I was working with an organization that is Rajiv Gandhi Cancer Institute and Research Center, and we were so strict about the training of the employees. It is whether starting from the induction training, on the job training, functional training, and we used to have a training passport. And then end of the year, we used to, in the performance appraisal, we used to calculate. It is performance appraisal. One of the parameter to judge the performance of the employee is the number of training hours, right? So I think what I remember was Rekha is here. She's from Rajiv Gandhi, who asked me the first question. I think 20 hours of training hours is mandated for an employee in a year. 20 hours probably. So if you are short of your training hours, then of course you are not complying, and accordingly your performance appraisal it will go down, and you may get a low score. So I think this is the way how we need to enforce that the training, to implement or to ensure the compliance of the training among the workforce. This is the only thing I think we can improve the training compliance in training of the employees.
Well, I certainly don't mean to monopolize this, but I meant something a little bit different in terms of compliance, which, yes, you have to have the training and the hours, but at least here in the United States, there are laws that must be observed and followed that are separate from an individual's competency in their particular area of expertise. And that area of expertise actually goes all the way from the custodial staff to the surgeons and the radiation oncologists and everybody else. It's the compliance that all of the governing and regulatory bodies require of a healthcare agency and the people that work in it. And that's a very, very specific training that is different from an anesthesiologist keeping up to date, et cetera, et cetera. And at least here in the United States, if you violate those various laws and regulations, the financial penalties are severe. They can be crippling. So that's why I brought it up, because if you get stuck for those kinds of penalties, if you, Medicare is the agency in the United States that provides care for the geriatric population, over 65 and others. If you are not careful in your billing and you create basically a false billing, that can be close to $30,000 for every mistake that you make. And a single patient could have 10 different things just in one visit. So that's $300,000 just there in penalties. And so that's why I brought it up, because it relates very directly to financial sustainability.
Yes, Flory, I'm actually, it all differs from country to country. United States has a very stringent laws, and penalties are very huge. Even, here also, if you see your credit hours, for the external training, the CMEs, it is mandatory there. In India, it is not. Actually, it is there that you need 100 training hours per year to get your, your medical license, your medical registration renewed. But it is not enforced. It is not mandatory, right? It is there, but but there in the United States, the laws are very stringent. That way, India is a country where we are not that strict and not that stringent with the laws in any area. If you see, the training is, of course, one part. And because we see that this is again indirectly, if what I mentioned in your performance appraisal, if you have not attended to the mandated training hours, so your performance score will go down and you will not be incentivized, or you will not be given increment accordingly. So because the performance appraisal is linked to your increment, right? So you will, that financial penalty is there for you indirectly, if you see. So that way, somehow, we are trying to, of course, ensure that the compliance is there in the training in all the areas. As you mentioned about the billing error, in spite of all your transparency in billing and everything, billing errors do happen, my experience, but it should not be intentional. Intentional billing errors, or, trying to, that is something which is not acceptable. But human error can happen, technical error can happen. So those things, but we need to analyze every mistake, every error, we need to analyze, and then accordingly we need to decide whether to give the punitive action, or how do we address, we try to improve. So that's where the role of training comes, and the role of monitoring of your processes, they come.
Thanks so much.
Thank you, Flory. Thank you so much
Sir,
for it. Thank you.
Dr. Chibban has a
Sir, Rajiv here. Yeah. Sir, Rajiv here.
Rajiv
Sir,
ji.
First of all, thanks a lot. It was a very enlightening session, and you brought in one very important point, that the health of the healthcare facilities and the broader healthcare ecosystem needs to be given a priority. Now, so you witnessed how healthcare has now changed over the last couple of years, and we're talking about affordability, accessibility, availability. But there has also been, a Supreme Court order where it has really used the word illegal profiteering as a part of financial stability under the present healthcare systems that we have, as a very bad spot on the healthcare system. So my question is, do you think that to make financial stability and affordable option for healthcare, is possibly price capping the best method to achieve affordable healthcare without hampering quality and innovation, which you mentioned, or bundled price packages, which actually also hurt hospitals, is something which we need to really move away from, so that this entire utopia of the perfect world where there is equity and equality in healthcare or education to achieve for a developed and a progressive nation can be really achieved. So, that's something which we need to really think on. Can the reducing of the cost of healthcare or providing free healthcare plague the entire healthcare financial stability?
Uh, yes, I think the first point was you talked about the illegal profiteering, which
No,
was
that Supreme Court basically, Supreme
yeah,
Court had just mentioned a couple of weeks back during that case. I don't want to mention the case, but how Supreme Court went heavily on the
yeah.
prices that private hospitals were looking at, on even the prices that medical devices or pharmaceutical medicines were, having. I give you a classic example of my own industry in the cardiovascular space. Stents was price capped way back in 2017 and 18. And if you look at it at that point of time, the Honorable Health Minister, NPPA, the Health Secretary said that this will provide a lot of profit to patients. But over the successive years, if you look at it, a single cardiovascular surgery has not even gone down from 3.5 lakhs to what the government proposed was 1.5 lakh rupees. And under Ayushman Bharat, if you look at it, the price packages for an angiography or an angioplasty is almost a bare minimum, where even hospitals are not willing to partner with Ayushman Bharat, or medical device companies also not willing to give their latest or innovative products. So my question is, will healthcare financing really impact affordability, availability, and accessibility? Sorry, I'm in a hospital right now. I'm really sorry, but there's disturbance. But
Uh-huh.
I hope I was loud and clear.
Okay. Thank you. This is a very, very tricky and a very, very important question. I think Rajiv ji is very smart in asking this question. You are, I mean, I think when you are talking of healthcare sustainability, healthcare financing, and reducing the cost, whether it will whether it will help the support the hospital to be financially viable or sustainable. I think this is not the answer. We see when we are talking of the government prices, let it be CGHS, ECHS, because CGHS is the mother of all the empanelments. So mostly, CGHS rates apply to all the other ECHS, ESI, but of course, Ayushman Bharat has a different rates, and some of the packages are good, and some of the packages are not really good, but still, 40% of the uh, Ayushman empaneled hospitals are private hospitals, right? Of the total empaneled hospitals, I think now 35,000 or so in the country, about 45,000 of the hospitals are private hospitals, 40% of the hospitals. So, uh, and this has been a big issue with the private hospitals regarding the rates, and also the late payments, deductions. All these, have been a great matter of great concern for the hospitals. And we have been advocating with the government, including AHPI, and other day we were invited by NHA, and the meeting was chaired by Dr. V.K. Paul, who's the Niti Aayog member, and they asked us to give the feedback. So we gave the feedback. We prepared a summary of the feedback, taking feedback from all the state chapters. And I presented, I talked about 15 minutes. And, this is one important issue about the rates, which they said they are looking into. If you see CGHS rates, they were 2014 rates and never revised. And after 10 years, you've seen that some of the room rent, ICU charges, doctor's fee, and diagnostic charges they have revised. But packages are still in process. Last 2 years, they have we have been advocating. So government, it is government rates. I mean, because CGHS was through the tender L1 rates. So L1 is something I don't know in healthcare whether we should go for L1. Some of the hospitals who were not even providing those services, they have applied for that services and they quoted very low. So those rates were accepted. So there are various challenges, and this I mean reducing the cost. Of course, it is you know, for the cash patient, hospital has its own pricing policy. Yeah, they follow their own pricing policy, right? That SOC, the schedule of charges, the tariff they have laid down, and they follow that. But then for the empaneled organizations, with the insurance companies, TPAs, and Ayushman Bharat, because they also need to sustain and survive. But then this definitely impacts. I mean, it is not the answer to reduce the cost. Reducing cost is not always the answer. Affordability does not mean that reducing the cost. Affordability, then you will compromise in quality. So you have to have a balance between the cost and the quality. I think that's all what I can say. And
No, I completely agree
I know
with you,
your
sir.
pain
I
points. I can
completely agree.
understand. Cardiology
Yeah,
stents.
yeah.
I was
It's
there.
from a, no,
I
no,
even we
yeah, yeah.
even
So
went
it's
to the
just that
court.
the industry,
Yeah.
when we say, when we talk about affordability, accessibility, and availability, and then we hear that further price capping is being done on not only devices but also health packages. That does not, encourage innovation. That does not encourage quality also.
And
So I
that
think it goes hand in glove.
I agree with you, and I understand your pain point. I am with you. I am also in the industry, and we actually work for the interest of our colleagues, our members, hospital, including you. So we are all together. This industry, healthcare industry, does not mean I am only with the hospitals, but you all are. We are all one. And these pain points we do understand, but then then the government, I think the policies, I think a time will come that they will realize and slowly things will improve, and we hope for that. But from our side, we are putting all the efforts in advocacy. We are trying to make the government understand, because it was never a consultative process. It was like government deciding their own, and then implementing whatever. So I think they need to include all the stakeholders when such type of decisions are being taken. So I agree with
Absolutely.
you.
Raghav, I
Thank
think Jody sir has two
Yeah,
questions, so
so I want
possibly
to
you could
take
go to
that.
Jody sir's question.
Oh,
Yes,
Jody
sir.
sir is
So
here.
I'll take a leave, sir. I'll take a leave. I'm in
Thank you,
hospital, but
Rajiv.
I'll
Thank
drop
you
off.
so much. Thank you, Dr. Rajiv. Thank you. Thank you so much.
Anil sir, would you like to unmute and ask your question?
Yeah, good evening, Dr. Khetrapal. Excellent
Sir, good
talk.
evening, sir. Thank you for being here.
My
Thank you
my
so much.
question is like any other quality professional. I mean, I have believed that quality should make money. Businesses exist to make money. We have to recognize that, generally speaking, and quality should make money. So, coming to healthcare now, is there any study which shows that accreditation actually led to more profitability? I mean, we say that all the time. We recount as benefits of quality and cost reduction, or you say that quality leads to cost reduction. Is there any formal study which shows that yes, quality led to formal cost reduction or accreditation led to profitability? Or could we have some kind of annual award in AHPI which actually asks
Yeah.
for case study of actual demonstration that if they introduced quality, it led to cost reduction or it led to profitability? Link quality with money in that sense, financial outcome. That was my question.
You mean to say that, implementing the accreditation and
That
quality
is
standards?
one way. Implementing accreditation is one way, but there could be any quality initiative which a hospital may take and then prove to a jury that yes, this quality initiative led to reduction in cost or it led to higher profit.
Okay. Uh, I think there are few studies because this NABH accreditation, when it came in 2006, some of the, the early ones, those who got the accreditation are the uh, in corporate hospitals, right? So some initially, I don't know whether there was a proper study made, but things are now, when it is actually obvious that quality implementation, when you implement quality and accreditation standards, you definitely, it will lead to profitability. And I remember some hospital, I mean, somewhere in South, I think they have done one study. So I'll come back to you uh, with that. And they have actually done one study on, the profitability that, and in the long term, implementing quality standards, it has reduced the cost, overall cost, and increase the operational efficiency and cost saving. So I'll come back to you on that. And
Sure.
yeah, but there are some international studies. I think I have not actually, I wanted to put some studies, but then I thought, the discussion would be too long and I did not put in my slides. But definitely there are some studies and I will definitely discuss with you on that.
Sunil sir, very good question. Even I'll also do some research. You triggered a lot of curiosity. Your question triggered a lot of curiosity. Thanks for raising that point. That how accreditation is improving the profitability and maybe the quality aspect. Even to that note, Sunil sir, I had a question. You mentioned a lot of financial metrics there. And you mentioned some quality or outcome-based metrics. What's the current state you would say of our healthcare system of measuring those quality metrics like hospital readmission rates and those kind of things? And what's the path looking forward to get the data maturity be looking like?
Yeah, very good question. Actually, some of these metrics, or I would say the indicators, are defined by the accreditation bodies like NABH and other accreditation bodies. They have even mandated the hospital. If you are NABH accredited hospital, there are some mandatory indicators. There are some service indicators, clinical indicators. Basically, these indicators revolve around the structure indicators, process indicators, and outcome indicators. So, readmission rate. Then this is actually your outcome indicator, because, and your patient satisfaction, average length of stay. These are outcome indicators, right? So these, yeah. So these, as some of all the NABH accredited hospitals, they are regularly monitoring this, right? And every 3 months, I think the quarterly data has to be submitted to in the NABH portal, those for those accredited hospitals. Because not only monitoring, collecting the data, but of course, analyzing the data and then taking appropriate, doing the RCA. And if you are deviating, you have to set a benchmark. When you are setting an indicator, you have to set a benchmark that, okay, my readmission rate should not be maybe more than, 1%, 2%, whatever benchmark you set. And if you are deviating from your benchmark towards the negative trend, then you need to do proper root cause analysis and take appropriate corrective and preventive action. We say CAPA, RCA and CAPA. First, you collect the data. First, you define the indicator, which indicator you want to measure in which area. You define the indicator. You set the benchmark for that indicator. You monitor that indicator. You analyze analyze it, and then you accordingly you do RCA and CAPA. So this is the complete. We say, the quality cycle, continuous quality improvement. So yeah, this is actually being done actually in many not only the big hospitals, corporate hospitals, some of the small hospitals which are NABH accredited, or they are also into this monitoring. And earlier there were 72 mandatory indicators by NABH, but now they have reduced it to 32. But still, over and above, if whatever you want to monitor, I can define indicators in each department. Maybe I have 20 departments in the hospital. I can define 2 to 3 indicators in each department. I can monitor 60 indicators. I can monitor 100 indicators. I think we should set a target of monitoring the indicators by each department in the hospital. Engineering department, he needs to have his own department. Biomedical, he needs to have his equipment downtime. He needs to have the equipment calibration, compliance. And, I think it is for all the departments to monitor. So quality is something, until and unless you measure and monitor, you will not improve. That's the importance of metrics, right?
No,
Yeah.
unless you can measure it, track it, you can't improve it. So that's well said. I know you had a busy day, sir, but just take the final call for any questions or comments, or ask Manish to add more comments here.
The
Well,
final
I
word
don't
by
have a,
Manish. It is a
yeah, well,
Manish's initiative. He was the one I
Absolutely.
forgot to mention. I gave him few topics, but he selected this topic. He said, "Sir, this is the one." So
Absolutely.
Manish prompted me to, go for this topic in the master
no,
class.
because
The
I
credit
know
goes
that,
to Manish, and thank you, Manish,
it's for you.
all your support.
And, idea is like to enlighten the industry. And, it was such an important topic. And I wanted this message to, go across, to the last mile of healthcare providers. And I know that you come with a lot of homework, a lot of research, and I've seen in action for the last 5, 6 years. So I couldn't think of any other name. And
Thank
I
you
don't
so
have any
much.
comment to offer. I have only compliments to offer. Well done.
Thank you
Very
so much. And
thought-provoking.
actually, I was in Pahalgam for last 2 days. Today, I reached Srinagar and I just checked in the hotel and I logged in for this webinar.
Yeah.
I was just
Yeah.
on time. Earlier, it was 4 p.m., so I knew I could not reach by 4. So, thank you very much for the
In
opportunity.
fact,
Thank
it
you
was
all.
very insightful. Couple of thoughts, have already come up in the back of my mind. Probably later on, I'll communicate to you. We could do Healthcare Continuum and AHPI could do some studies together, because Raghav is an excellent data scientist. Data analytics is excellent. He worked in USA, he worked in London. Now he's coming back to India. So he was Raghav, which organization you were part of in USA?
I was part of that is associate mid-sized consulting firm, but I worked with many biopharma companies, sir. 3 of the top 5 actually global biopharma companies, and have deep expertise in patient health data and data analytics there.
So, Dr. Saab, we'll come back to you once you come back to Delhi, and let us see how we can take this forward beyond this masterclass. Thank you so much for making yourself.
Sunil, it was
Thank you.
great.
Thank you, Flori. Thank you so much for being part of this masterclass.
Thank you for doing it. Great to see you. Come to the United States.
Yeah, I'll come definitely. When I come, I will definitely meet you. Right?
Perfect.
Thank you so much.
It's a deal. I think I'm going to go to sleep now. Bye.
Good night. Good night.
Thank you, everybody.
Thank you. Good night. Good
Thank
night.
Thank you.
Bye.
Thanks
Bye.
again, sir. I think there are a lot of comments coming in the chat about how informative the session was, and people found a lot of value and insights to take away. So thanks again for sharing your time with us today. And I know you had a busy day, so I would not stretch further and give you time to rest. So, but thanks again, and thanks everyone for your participation, and follow the LinkedIn page for more updates. And we look forward to see you in our next master classes.
Thank you,
Thank you,
everybody.
Raghav. You have been an excellent moderator. Thank you, BigPodium. Thank you, Healthcare Continuum. Thank you. Thank you so much. Thank you. Bye.